We opted to use the Fuji-Rabio plasma p-tau217 assay, which is a LumiPulse research use only assay that has been analytically and clinically validated. And so we're using this assay as part of our screening process. One of the things we noticed in our phase 1 study was that we had a high screen failure rate due to amyloid negative PET scans. And so in order to try and address this in our phase 2 study, we decided to use this plasma p-tau217 biomarker as part of screening. We chose plasma p-tau217 because as a standalone biomarker, it's consistently demonstrated high performance in detecting Alzheimer's disease pathology in early stage AD patients. We've seen a lot of research that has come out recently looking at some of these plasma biomarkers as a way to diagnose Alzheimer's disease. But in our study, we are not using the p-tau217 as a diagnostic tool. For us, it's serving as an enrichment strategy. And what I mean by that is it's helping us to identify participants that are likely to be amyloid positive on PET or CSF. What we've seen is that using p-tau217 as a screener has significantly reduced the rate of amyloid negative PET scans. 48% of the study participants have met or exceeded the p-tau217 cutoff, with 78% of these participants being confirmed as amyloid positive either via PET or CSF. So p-tau217 is now the number one reason for screen fail. The total screen failure rate for amyloid PET has decreased from 60%, which is what we saw in our phase 1 study, now to a mere 7%, which is what we're seeing in the ongoing Altitude AD phase 2 study.